Today the topic is today we will discuss about the beta lactam antibiotics. Beta lactam beta lactam antibiotics. This is the most interesting topic in the field of antibiotics. That is how we will classify the beta lactam antibiotics. They are classified into class 1, class 2, class 3, class 4 and class 5. There are total 5 classes of beta lactam antibiotics. The class 1 includes the penicillin group. Second class includes the cephalosporin. We know about the cephalosporin. There are further classified into 5 classes of cephalosporin: 1, 2, 3, 4, 5. And the class 3 of the beta lactam includes the monobactam, that is Astronam. And class 4 of beta lactam includes the carbapenem group, that is imipenem, meropenem and ertapenem. And class 5 includes the beta lactamase plus beta lactamase inhibitor group, that is for example that is amoxicillin plus clavulanic acid. This is amoxicillin is the beta lactamase and beta lactamase inhibitor is the clavulanic acid. What is beta lactamase? Some bacteria, that is the bacteria. This bacteria, what is it? It produces an enzyme called beta lactamase. This beta lactamase inhibit the beta lactam antibiotics. Understood? This beta lactamase inhibit the beta lactamase antibiotics. That is, under all the classes of the 5 classes of the beta lactam antibiotics, the beta lactamase inhibits the 5 classes of beta lactam antibiotics in some extent, not always, some extent. It may inhibit lesser or it may inhibit longer or more. In some extent, beta lactamase inhibit the beta lactam antibiotics. Understood? Then comes on the beta lactamase. The classification of beta lactamase. This is the produced by enzyme. This is a bacteria. This bacteria produces the beta lactamase enzyme. Then what are the types of beta lactamase these bacteria are producing? According to the classification, there are 2 classifications. First is the Ambler's classification. This is most important. Pay attention. That is Ambler's classification. It divided the beta lactamase into 4 subgroup. That is A, that is D, C and B. Okay, Ambler's A, Ambler's B, Ambler's C and Ambler's D. Ambler's A is also known as extended spectrum beta lactamase. I'll tell you about the cell. The extended spectrum beta lactamase, this inhibits, what is ESBL? It inhibits, that is, it is resistant to all penicillin plus first, second, third and fourth generation cephalosporin plus it also inhibit or resistant to the monobactam group. monobactam group, that is Astrona. Understood? The extended spectrum beta lactamase, that is inhibit the all penicillin group and the first, second, fourth generation cephalosporin group and the monobactam group, and it is susceptible to, then if there is resistance there should be some drug to kill this bacteria of the ESBL producing bacteria. They are susceptible to, one is the cephomycin. This includes the cefoxitin and cefotatam. These are the two antibiotics comes under the cephomycin group, and another group that is susceptible to ESBL, that is the carbapenem. That is IPM, MRP, the ATP. They are susceptible to ESBL, and the ESBL is resistant to these ampicillin, cephalosporin and monobactam. They are come under the ESBL. Then comes to the first, the A, group A is come. Then group D is called as Ogja beta lactamase, Ogja group. That is resistance to oxacillin group of penicillin, not much. Then the third is the AMC beta lactamase. AMC beta lactamase. This is the most danger, and it is resistance to almost all drugs. This is the most dangerous. And the fourth one is the group B, is the beta lactamase, which is also known as MBL, beta lactamase. The danger here is the AMC beta lactamase. They are resistant to many other antibiotics. What are they? AMC. They are resistant to what they are resistant to? They are resistant to all penicillin, like in ESBL, all penicillin plus first, second, third generation cephalosporin plus cephomycin. Cephomycin is sensitive or susceptible in ESBL, but here is the cephomycin is resistant. Also there is BLI combination. BLA combination is resistant, and previously the ESBL, there is another, there is cephomycin, carbapenem, and another third one is the BLA combination. BLA combination is sensitive to the ESBL, but here is the BLA combination is resistant to the AMC producing bacteria. How AMC is killed or susceptible to, that is, first is the fourth generation cephalosporin, and carbapenem. They are the drug of choice or drugs that are given in the AMC producing bacteria. Then comes in the mind that why AMC is developed. Why AMC is developed. There are many mechanisms that AMC is developed. First one is the inducible chromosomal resistant. Inducible chromosomal resistance. Suppose, let's understand this. Suppose there is antibiotics A. when you give antibiotics to a patient, to a patient to kill the bacteria. This is the bacteria, this is the bacteria, this is the yellow one is the bacteria. What this causes, the the antibiotics causes there is increase the enzyme concentration in periplasmic space, periplasmic space. When there is increase in enzyme concentration in periplasmic space, the antibiotic requires less or more, the antibiotic concentration, the antibiotic requirement is more, that is increase in MIC, minimum inhibitory concentration. Then when some antibiotic, not all antibiotic, when some antibiotics, what this causes increase in the enzyme concentration in the periplasmic space of the bacteria, which causes increase in the MIC, minimum inhibitory concentration. When there is increase in the MIC, that is the drug develops to resistance, this is called as the inducible chromosomal resistant, inducible chromosomal resistant. Okay, this is called as the inducible chromosomal resistant. These drugs are classified into two groups. These drugs are classified into two groups. Let's erase this. These drugs are classified into two groups. That is, what are the groups? In the inducible chromosomal antibiotics, the antibiotics which causes induction is called as the first is the potent inducer, and there is a weak inducer. That's a weak inducer. And potent inducer, that is, the induces the increase in the enzyme concentration in the periplasmic space, leading to drug resistance. This is the potent inducer as the all the aminopenicillin, that is the ampicillin, that is the amoxicillin or amoxicillin, and another one is the cefamycin, mainly the cefoxitin and cefotitan, and another one is the first generation cephalosporin, These are the potent inducer of the AMC, Then another term is the weak inducer. They are less likely to increase the enzyme concentration in the periplasmic state. That is the aztreonam, piperazine tazobactam, ceftazidime, and that is CTR, means ceftriaxone. These four are weak inducer of the AMC development. This is the inducible chromosomal resistance. Then comes to the some bacteria produces directly the AMC beta lactamase enzyme. This bacteria has special name, that is the spice organism, SPICE. These are the spice organism. What are the spice organism? S stand for Serratia, P stand for Pseudomonas, and I stand for indole positive proteus, that is Providencia and Morganella. These are the indole positive, and C side for the Cytobacter, and E stand for the Enterobacter. Understood? These bacteria are produce, that the spice bacteria produce AMC beta lactamase, which causes the resistant mechanism. Why IMC is important? We see IMC is resistant to all penicillin group, all penicillin, that is ampicillin, amoxicillin, all group of penicillin group, and that is the first, second, and the third generation cephalosporin, and the cephamycin and the BL-BLA combination. These are susceptible in the ESBL, but here they are the resistant, and only the susceptible is the fourth generation cephalosporin and the carbapenem group of antibiotics. This is all about today. Thank you.